prepared to turn this over now.
Great. There's a lot of people who have not been heard from yet, but here's what I'd like to do in focusing this part of the discussion. We've heard that there is a great support for health care for all, so that you don't have people denied. I think that we can agree that that's got to be a component of this. We've heard a lot of people saying that there must be a focus on electronic medical records to bring down the costs. We've heard a lot of people who support single payer, and then there's been some probably political reality in there about what is possible or where do you start. I don't think anything's taken off the table, but ultimately by the end of this year, we want to have a solution that we can all get to. But the bottom line is I'd love to hear from people whose concerns have not yet been raised, because we only have the White House for a small amount of time. So, yeah, let's start with you right here. And I'd ask, as she gets the microphone, for those who are also raising their hands or who want to, I'd be interested again in recognizing that we've got to get across the finish line. Making this an economic argument is part of that. And so for those who are from the business community or from families who can help to make that economic argument, I'd love to hear from you too.
I'm Cheryl Leisinger. I'm with the National Organization of State Offices of Rural Health. And I've not heard anyone talk about the people who may not be represented in this room, and that is 60 million rural Americans. And Melody, you asked us what were we going to do? What's our game plan? My game plan and the game plan of all of us should be to work together, to not polarize, to not point our fingers at the guys in the suits, not point our fingers at the guys in the white coats. And I don't want to look around the world for solutions. I want the president to focus on community solutions. We're uniquely American. We have good ideas. We're entrepreneurs. We send our smart guys in high school off to med school. We send our caring gals and guys off to nursing school. We send the guys with the little pocket protectors off to learn about computers. We can do this. We have to focus on a good way to help communities pay for their health care. We have to get the people who want to take care of them into those communities across the nation. And we have to make sure that they have the equipment and the tools and the computers and the infrastructure to take care of our business. Smart people can do it.
Thank you. We're going to be as crisp